Very good evening to all of you. Today we are going to discuss the case note of Mr. John Simpson. This maybe a letter which is very familiar to you with another name because I remember the name has changed in another letter, but the condition is the same. Anyway, I'll go with the existing name here. This is John Simpson. I remember that the previous name was Bob Dawson or something like that. A couple of years we have sold it. This is a letter which is written to a senior nurse at Parker Nursing Home, 28 Hilly Road. And this letter is written to, just a minute, please. Yeah, this letter is written to update the condition of Mr. John Simpson to this particular senior nurse, that is Miss Angelina Hawker. And also to request continuity of care from the nursing home where Mr. Simpson is a resident. So that's it. Now let us move ahead with the patient name is Mr. John Simpson. I remember the patient's name was something else before. Maybe some might have changed this name. The 78-year-old patient on the ward of the hospital where you are a charge nurse. So you are a charge nurse, and Mr. Johnson is your 78-year-old patient who has sought an elective surgery for worsening osteoarthritis. The surgery was done on 3rd of October 2019, and that was left hip replacement surgery, total hip replacement surgery, because he was recommended to have this surgery on 2018 because of osteoarthritis. You can see that medical background. You can see osteoarthritis in 2018 requiring a total hip replacement surgery, and this was done this year, that is in 2019 October, and that was an elective surgery. So it is a very planned surgery. So he might have his pre-operative assessments done before, and he was posted for the surgery on 3rd of October 2019. So social background, all these things are irrelevant here because the patient is from the nursing home and you're writing to the senior nurse in the nursing home there. So it has no relevance here. Sorry. Now, we have the medical background too, which is not so important here because he has hypertension, Coles-Walcher, osteoarthritis. All these things was known to the carer. Now the medications. Now we have aspirin 100 mg man and ramipril 5 mg mani. So Panadine 4, that's paracetamol and codeine. All these things were recommended after the surgery. So this we have to update. So after the surgery, we have aspirin, we have ramipril. Maybe it has been going before. Maybe they have changed the dose or something like that. We might not know, but we need to update the medications after the surgery. So aspirin, ramipril. And whenever required, we need the pain medication, that is Panadine Forte. So that's what we have here, which is important for updation. Now we are updating that the patient has given a daily dressing, stretching and strengthening exercises, occasional therapy, staples to be removed in 2 weeks, follow-up foot blood examination, and urine electrolyte creatinine test at Fortis Hospital. And all these things are important. You need to organize it in the correct order and you need to present it. That's it. So all these things are important, but in which order you need to organize it, because it is disorganized in the case note. So we need to arrange it in a particular order. First, the surgery, post-operative recovery, medicines, all these things has to be arranged in a particular order. Now, assessment is about the after the surgery. He has good mobility. Now he's wearing his own weight and he is walking in with the help of a wheelie walker in length in the ward without any difficulty. Now he has something which is very important, which we need to intimate the carer, is that his hemoglobin went down dramatically to 72 gram per deciliter post-operatively, for which he was given 3 units of packed blood cells. So now we have to intimate that this has happened and he needs to be monitored continuously for further incidents of anemia, that because he is vulnerable, he is at risk of anemia. He required continued monitoring, and this is something very, very important you need to say. Instead, some people, they focus on disorientation regarding time and place during recovery, possibly related to anesthetic. Because he has made good progress and he is maintaining good mobility, all these things right now. But he still, what's the major concern here is the risk of anemia that is to be highlighted here. Now, the discharge schedule. Here we have monitoring medication, preserving skin integrity, continuing exercise routine. And we needed equipment, we needed some equipments, and we have arranged. So the hospital has to be hospital to provide a walker and a pillow, and this will be done before discharge. So the schedule is the discharge schedule is just before the discharge. So when the patient is discharged, the wheelie walker and the verge pillow will be there with the patient. So it will be provided. So hospital has made arrangement, hospital has provided. Hospital social worker organized 2 weeks hire of toilet raiser from a local medical supplier. So already it is done. So arrangements for the discharge is done. It means when the patient is discharged back to the nursing home, he will be having a wheelie walker, verge pillow, a toilet raiser. So these equipments required equipments will be there with him. So this is confirmed. But the senior nurse has to monitor the hemoglobin, medication, skin integrity, and exercise routine. So this is what we need to see here. So that is it here. We don't have any complex things here. Many of the candidates have done this thing, but I hope that the name of the patient was different, and the hospital name was also different, I think so. Now let us go ahead with the answer here. Let's go with the answer here. In a single page, I can finish. The date of discharge is on 7th October 2019, and we are writing to Miss Angelina Hawker, Senior Nurse and Parker Nursing Home on 28 Hilly Road. Dear, the surname Miss Hawker, reference Mr. John Simpson, age 78. Writing to request continued care for Mr. John Simpson, one of your residents, who was posted for a left total hip replacement surgery. He is ready to be discharged from our facility today. So many of you candidates are comfortable in writing like this. I am writing to update the current health status of Mr. John Simpson's. There is no problem in going ahead with that. I have tried a different way. So most of the students, they are convenient or they're comfortable in writing like this. I'm writing to update the current health status of Mr. John Simpson. It's perfectly all right. So we have done an alternate, we have tried an alternate way that said, I'm writing to request continued care for Mr. John Simpson, one of your residents who was posted for a total hip replacement surgery. He is ready to be discharged from our facility today. So it is clear. Perfect. As you are aware, Mr. Simpson underwent the aforementioned surgery on 3rd October 2019 because this is an elective surgery, and the carer knows when the surgery was scheduled, and that's the reason why he was transferred to the hospital on 3rd October. That was the admission date. Postoperatively, his hemoglobin level dropped to 72 grams per deciliter, for which he was transfused with 3 units of packed red blood cells. So this is somewhat we have to make arrangements, because the order in which the case was given there was different, but we need to organize it. So what happens after the surgery? What was the immediate concern after the surgery? The post-operatively, there were some complication. Yes, there was a complication. Yes, the complication was hemoglobin, the drop in the level of hemoglobin. And what was the solution? The solution was that 3 units packed red blood cells were transfused. Now, we can write that he requires continuing monitoring for anemia in the request paragraph towards the last. But instead of doing that, we have written it here. This is written. Why? Because we need to avoid a repetition of words. That's why it is given here. So there is no specific reason why this particular sentence is here instead of the last paragraph. However, ongoing monitoring is required since he is vulnerable to anemia. So you can write continuous monitoring for anemia is required in the last paragraph. Instead, no problem in doing that. Just to avoid a repetition, we have done that. So you can do it in either way, no problem. So once we have said something about hemoglobin and anemia, we try to finish it in that area itself. That's what we have done there. Was also commenced on aspirin and ramipril, and his recommended pain medication is Panadine 40. So he was on Panadine 40 and it was PRN. So that's what the pain medication which was recommended. It was given at the hospital. So he was commenced after surgery. He was commenced with aspirin and ramipril. So I think the dosage also should be included. I think 100 mg and 5 mg. I just check and add it right now, please. It's 100 mg and 5 mg. Exactly. Aspirin 100 mg and Ramipril 5 mg. Okay. So the dosage also, we added the dosage. Mr. Simpson was provided with daily wound dressings, exercise programs, and occupational therapy at the hospital. We had tried to consolidate everything into one sentence, so we don't need to explain everything in detail. So we don't need to say that daily dressing was provided at the incision site. Don't need to expand all these things. Daily, we know where the dressing has to be done. So we have to say, in short, daily wound dressings. So exercise programs, instead, we are not going to write strengthening exercise, stretching exercise. So we are not going to explain everything in detail. So we just make it brief. Daily wound dressing. It is understood where the wound dressing will be there. It will be at the site of the surgery. Exercise program. What type of exercise? What type of programs? Exercise programs are needed. So we don't need to explain all these things unless it becomes relevant in particular cases. And occupational therapy. So occupational therapy, as a result of these care, that is wound dressing, exercise programs, and occupational therapy, which enable him to develop good mobility post-operatively. It means, so all these care has resulted in making him develop good mobility. So we have not written that he is able to walk long distances in the ward with the help of wheelie walker. He can bear weight and all. They just said developing good mobility post-operatively. It makes sense. Now, what is more important? So instead of telling that he is able to walk long distances with wheelie walker, you have to say that some equipments are needed after the discharge. So those things hospital has also made arrangements for a wheelie walker and a wedge pillow. So arrangements are made. So by discharge, it will be there with the patient. So that's what we have said. Arrangements had also made for a wheelie walker and a wedge pillow. In addition, the hospital social worker organized a hire of a toilet racer for him for 2 weeks. So these things are very clear what we have done. This is nothing related to medicine or something else. It's something related to the patient well-being and mobility. So that's why we have written in a separate paragraph. So the wheelie walker, wedge pillow, toilet racer, all these things are related to occupational therapy, wound dressing, and exercise programs, something related to the mobility. So we have separated these things into one paragraph. So it's something separate. The first paragraph is separate. That's about the post-operative complication and the medications. So the updation about the surgery, the post-operative complication, the remedy, the medicine, and the recommended medicine was there in the first paragraph. The second paragraph, daily dressing, exercise program, occupational therapy, equipments required, and the arrangements made for the equipment required. So this is what we have seen in total right now. Now, let's go ahead with the discharge plan. Upon discharge, Mr. Simpson needs your assistance in monitoring his medication compliance, skin integrity, and routine exercise programs. Please be aware that he has his stable removal scheduled in 2 weeks and has follow-up blood test at a hospital clinic. So this is somewhat, I made it very brief because I added the monitoring of hemoglobin in somewhere else. I added the arrangements of Willy Walker, wedge pillow, and toilet razor in another paragraph. So most of the candidates, they push everything in the discharge paragraph here towards the last, and this makes so this makes somewhat the paragraphs looks awkward. Now, now when you look at the letter, it's almost equally organized. All the middle, the body paragraphs almost are equal sized. So it looks beautiful, and it gives the examiner a good impression. So you can write. So if you can write one sentence in one paragraph, you can write 5 sentences in another paragraph. That is up to you. There is no rule, but it's always better to make your letter attractive. Try to make almost all paragraphs in equal size, and the beauty of the paragraph, the words which you use in the paragraphs. So these also are important. So everything is well connected here. So we have finished the case of Mr. John Simpson. I hope that we'll meet with another letter soon. Till then, bye.